Baker's back with the Freya Mills. You're in a supine position again, head supported if you need it, knees bent. And I want you to feel that you've just got that tiny little gap in your lumbar spine, which we call neutral. Just think relax. You're resting right in the centre of your sacrum, which is this slightly curved bit. Okay, the first time we talked about pelvic floor, we talked about north to south. We talked about the coccyx coming towards the inside of the pubic bone. I'm going to ask Freya now to think about the sitting bones being east to west. Some people say they find it a little bit harder to get this than north to south. Other people say they find it easier. Remember, none of these exercises should cause you any pain or make any of your pelvic pain or back symptoms worse. So I'm going to ask Freya to just relax. She's got her hands on her hips. And if you have time, just take a few seconds to do some breathing and just be conscious that you are not activating your pelvic floor consciously. So you can tell the difference between you just taking some breaths, and you can tell the difference between when you are consciously contracting. So feel that at this moment in time, you're just taking some breaths and the area between your legs is just consciously relaxed. You should not feel like you're pushing down. You may not feel like anything's going on. You're just not actively switching it on. Okay, so I want you to visualise that you are going to bring east to west. So you are bringing your sitting bones closer together. Remember, they don't move. They're not a movable object. But what you are doing is contracting the muscles and fascias, working fascial connections from other muscles as well. As you're visualising, you're drawing east to west, and just let it go. Ladies and gents, if you can't find it, don't worry, but just visualise you're drawing east to west. Now, I wouldn't ask Freya to do this now, but I would like you to do it at home. You can always put your fingers between ladies' vagina and back passage, gentlemen, testicles and back passage, that's your perineum. And as you're visualising, you're drawing your sitting bones closer together and you are lifting up from your back passage. You should feel a very slight lift from the perineum. If you can't, don't worry. Hands in the same position now as Freya's. And I want you to visualise you are drawing your sitting bones closer together, east to west. You are lifting up from your back passage. Your pelvis should not be moving. Keep doing it, let it relax, do it again. We're just trying to find it. There's no movement in the spine, the tummy's not actively contracting, there's no movement, your hands are here so you're not moving your pelvis. But am I right that you might feel a bit of a connection, don't know if you are, Freya, just right underneath your buttocks? We're getting a bit of what's called a fascial connection, don't worry about that. Some of you may feel a little bit of a connection really low down in your abdominals. That's brilliant as long as you're not actively contracting your tummy. Let it rest. Folks, do what you want to. I'm going to say to Freya, she can hug her knees in, she can stretch out, she can rock her knees from side to side, relax your arms, do whatever you need to, just have a quick relax. Okay, let's go back to what we did previously. So Freya, you can let your hands relax this time. I'd like you to visualise that you're trying to draw north to south and let it go. Think about drawing your coccyx towards the inside of the pubic bone and let it go. Now, if you've been practicing this, you should have got this by now. Remember, it should not cause you any discomfort or pain. So if you're drawing north to south, I'd like you to lift up from the front, testicles to spectacles, and let it go. Do it again. Make sure you're not holding your breath. I'm going to ask Freya this time if she can do testicles to spectacles. Draw up a bit more from the front. And I'd like you to feel as if you can hold it for a few more seconds. And can you release it a little slower? Please don't worry if you can't get that. That just takes time. Make sure you're breathing normally. There should be no activation in your buttocks, but you might feel it underneath. Remember, No movement in the spine, but you might feel a little bit low down, and if you do, I'm happy. Okay, quick relax, have a quick movement, move your legs. If you feel you want to move your spine, if your spines feel uncomfortable, you go for it. Okay, now this time I want Freya to go back to thinking about drawing her sitting bones east to west closer together. And I just close my eyes then because I find it easier if I close my eyes and let it go. So you're trying to draw east to west closer together. You're trying to draw up on the back passage, and then you're trying to release it. Just try and find that. If you can't do it, do not worry, it takes time. Remember, it should not be causing you any pain or discomfort. Folks, you're going to rest again. Have a quick rest, a quick walk, relax. We're going to do another version of the second family of east to west. A lot of people said to me, Cherry, it's either up or down, there's no in between, but see how you go. So relax, breathe normally. Think about drawing east to west closer together. Lifting up from back passage, make sure you're not holding your breath. See if you can lift a little tiny bit higher. And let it go. 3 seconds, 2 seconds, 1 second, and relax. Just try and do that a couple more times. It's much easier with your eyes closed, isn't it? I just find it so much easier to get with your eyes closed, but just don't close your eyes when you're driving and you're doing it. Okay, now let it go. Forget about it. Move your legs. If you want to move your head, if you want to move your arms, please do. We're going to now do an exercise. So I'm going to ask Freya to put her hands back onto her hip bones. Excuse me while I change the position of my legs because I'm getting cramp and I'm sitting like this because I can. So you're going to go, relax. I'm going to ask Freya to keep this knee still. Focus on your sacrum. Think about keeping this slight curve in the sacrum flat and still. Freya's going to lower the leg that's closest to the camera, only as far as she can, keeping this knee still, and bring it back. Changing legs. So now the focus is on this knee staying still. Freya's keeping the sacrum as still as she can. Breathe. So as you're lowering the leg, it doesn't matter how far you can go. It matters how still you can keep the pelvis. Relax the jaw. So you're being mindful that the leg that's still should not be moving. And let it go. Do it again. So this leg that's still should not be moving. Breathe normally. Keep going for me. So guys, I'm going to ask Freya to keep going and I'm asking you to keep going and just listen. Earlier on I was saying that if you get any pain or discomfort on doing pelvic floor, don't do it. I want you to get some medical advice, see a pelvic health physio. However, you could do the exercise. Don't do the pelvic floor exercises directly unless you get advised to, but you could physically do this exercise without the pelvic floor connection. It might help you. Okay, rest. So what I'm going to now do is ask you to include the pelvic floor if that's right for you. If it's not right, don't. So as Freya lowers the leg that's closest to camera, Freya, I want you to contract the pelvic floor and bring it back. Changing legs. Now I'm going to say to Freya she can do east to west, north to south. She can do the two together, but we've not discussed that yet. So I'm just going to say to you, use whatever pelvic floor connection you want. So as you lower the leg, you are thinking of drawing the pelvic floor upwards and inwards and release. So as you lower the leg, you contract the pelvic floor, and as you bring it back, just forget about it. Pause for a second and start again. Now this bit might be a bit tougher. If it confuses you, just breathe. Have a rest for me, Freya. So Freya's going to lower this leg. Try and connect into pelvic floor and breathe out. Soft breath out as if you're blowing out through a little tube. Breathe in. Now relax. Rest everything. Breath in again for me, Freya. Breathe out. Lower the opposite leg. Pelvic floor connection. Breathe in as you come back, relax. Let everything relax. Take a breath in. As you breathe out, Freya, lower the leg. Contract the pelvic floor. Think of drawing up between the legs, males or females. Breathe in, relax, and just rest. Just rest. Breathe in again. Breathe out as you lower the leg. Contract the pelvic floor. Draw up between the legs. Breathe in as you come back. Just completely relax. Forget about your breathing pattern. One more time. Breathe in again. As you breathe out, lower the leg. Breathe in to come back and relax. Folks, give yourself a breather, and I would advise hugging your knees into your chest if that feels comfortable. If you've had a hip replacement, don't bring them all the way in. Just a little rock from side to side. Thank you so much. Do a few pelvic floor exercises whenever you get the chance.